Thank you for your time this afternoon. My name is Mags Rogers. I'm the CEO of the Neurological Alliance of Ireland, which is the national umbrella for nearly 40 neurological patient organisations throughout the country. Thank you for joining us this afternoon. We want to use this opportunity to highlight issues around neurology services for the Midlands Regional Hospitals in Tullamore and Mullingar. Approximately 1 in 6 people throughout Ireland is living with a neurological condition, and that accounts very approximately to nearly 50,000 people across the counties Laois, Offaly, Longford and Westmeath. I want to highlight from the outset that we are looking at both hospitals in the one meeting this afternoon, the Midlands Regional Hospital Tullamore and Midlands Regional Hospital Mullingar. And that's because there are similar issues applying to both of those regional hospitals, namely access to neurology services and adequate resourcing of the neurology outreach service to both of those hospitals. I want to extend a warm welcome to the TDs and their representatives and local councillors who have made their time in a very busy time of year to join this meeting this afternoon. I just want to encourage them to use the chat function just to introduce themselves and let us know who they're representing on the call today. That would be really useful if they could just take a moment or two to pop into the chat who they're representing at this afternoon's call. Also, just to note that this call has been recorded and will be shared with elected representatives who couldn't attend the call today, and also anyone who is attending this afternoon. You will shortly hear from Dr. Damien Ferguson, who's a regional consultant neurologist for the area, and I'm also hoping to hear from, she's just having a couple of issues joining us, from a local person with lived experience. Just to note that following on from this meeting today, the Neurological Alliance of Ireland pre-budget submission will be launching in the coming weeks on the 24th of June. And the issue of regional neurology services is a significant issue in our pre-budget campaign this year. That's following on from the commitments in the current programme for government to the resourcing, increasing the resourcing of neurology services. So regional neurology services will be a significant focus in our upcoming pre-budget campaign. I'm going to hand over now to Regional Consultant Neurologist Dr. Damien Ferguson, who's going to speak in relation to the neurology outreach to the Midlands Regional Hospital Tullamore.
Hello everyone, hopefully you can hear me, and I should be sharing slides if anybody could just let me know. Yeah, great. So my name is Damien Ferguson. I'm a locum consultant neurologist based in St. James's Hospital, and I visit Tullamore Hospital once every fortnight. It's based on point 2 of a consultant contract that I'm backfilling for somebody else whilst they're seconded to the HSE. So just as Mags alluded to earlier, there's a growing emphasis and growing awareness of the neurological burden of disease across Ireland, but also internationally. And the most recent paper from the WHO states that 42% of the world's population are affected by a neurological condition at some stage in their life. And neurological conditions are the leading cause of ill health and disability worldwide. And 1 in 3 countries, according to the WHO, have a brain health strategy, but Ireland does not, and it's a bit of a gap at the moment. I was recently at a talk given by Paul Boone, the head of the European Academy of Neurology, and he showed this slide, which just to highlight to everybody in the top row center, this is the number of neurologists per 100,000 population of the 100,000 of the population, and in the top row center you'll see across Europe there's about 9 neurologists per 100,000, and then if you look in the bottom left, Ireland is ranked last for that number per capita with only 1.3 neurologists per 100,000. And if you look at the Midlands specifically and just take the county of Offaly, there's 0.25 of a neurologist per 100,000. Laois County has a slightly higher ratio, and then Westmeath and Longford don't currently have any active service. In our region then, so we're in Regional Health Area B, Dublin and Midlands, and just the map there, the areas in yellow are the areas served by this RHA. And the purple star there in Westmeath and Mullingar was a service that was provided on a 0.2 of a consultant visiting from the Mater, but that service is currently not up and running. And then the red stars are Tullamore Hospital and St James's Hospital, and we will hopefully be taking on Mullingar if things change, just with an agreement, because Westmeath is no longer in the region of the Mater Hospital. And then the blue stars are Tala's outreach service. So they visit Portlaoise 3 days a week, I believe, and Naas 2 days a week. And the population for our area is 1.1 million people. And the county of Offaly in the 2022 census had a population of 82,000, Westmeath 95,000, and Longford 46,000. So just a little bit on the unmet neurological needs for Tullamore Hospital in particular, because that's where I visit. So we looked at the admissions data for 2025 and just took 5 of the top presenting complaints for neurological presenting complaints, that being headache, seizure, stroke, abnormal movement or weakness of a limb, and dizziness or vertigo. And just for those 5 presenting complaints, there's 650 admissions to the hospital. That's not ED presentations, that's admissions to the hospital. And in terms of a more focused look on seizures, this was an audit that I carried out with an emergency medicine specialist registrar and 2 medical students from the University of Limerick, looking at 12 months of seizure data just to see if we could improve pathways between Tullamore and St James's. We found 185 presentations to their emergency department with seizure, of representing 131 patients, 32% of those being first seizure presentations, which is really important that those people are seen by a neurologist. 70% of people get admitted to the hospital following a seizure. Only 17% had a touch point with neurology, whether it be virtual advice or inpatient review. And then after discharge, only 29% of people were received in our neurology department. So just in line with Sláinte Care, which is the cross-party reform programme for the health service, it emphasises that people should be getting the right care in the right place and the right time. And it's my opinion that certainly the people of the Midlands are falling foul of this and not receiving the right care in the right place at the right time. Thank you very much for your attention, and happily take any questions.
Dr. Ferguson, thank you for that. And just before I move on to the next speaker, you might just clarify just again for us, just I know a couple of people were late coming onto the call, just the current outreach provision to Tullamore Hospital.
Yeah, so there's 0.2 of a consultant, with the 0.8 being in St James's Hospital, but 0.2 funded for Tullamore Hospital. And that involves a virtual clinic Monday, Wednesday, Friday from 11 to 12:30 for Tullamore to ring me directly here in St James's Hospital. And then every second Thursday I visit for a full day of inpatient reviews. There is no outpatient clinic because the volume of consults for inpatients is so high, it's unsafe to provide a clinic service on top of that. And just for context, we pulled some data here in St James's Hospital, and for the year of 2025, we reviewed 532 people in our outpatients here in St James's Hospital whose address is County Offaly, and that's of 7,560 cases reviewed in clinic total for St James's.
And presumably if people do want to attend an outpatient appointment, they have to travel to you in St James's Hospital.
Exactly. Yeah.
Okay, which is a very significant journey.
And I don't have the exact figures, but my sense of things is that the attendance, the non-attendance rate for people from Offaly is slightly higher than those for people who live in the Dublin region. And presumably that's due to travel and difficulties traveling. Because I know to travel from Birr, which is West Offaly, all the way to Dublin is about an hour and 40 minutes with no train line.
And I know that there is a consultant neurology service in Portlaoise Hospital, but that has only just started, if it is even started. And again, the volumes, as you say, the volumes of people in that catchment area for Tullamore Hospital would absolutely warrant the provision of a dedicated neurology service for Tullamore Hospital. And I know you are speaking on behalf of Tullamore Hospital, but as I said at the outset of this call, we are aware of very similar issues. In fact, a worse situation with the Midlands Regional Hospital Mullingar, where there has been a gap for some time in the provision of that service, a consultant neurology service for Mullingar, but it would have been at a similar level to what has been provided to Tullamore. But I understand for the last couple of months, it has ceased entirely. And then eventually the hope is to move it to under the care of St. James's. But again, that hasn't been clarified in terms of the resourcing that will be available for that. And given that Tullamore, the service provided, the outreach provided from Tullamore, from St. James's to Tullamore is already inadequate for the needs, we've no reassurance that when the service moves under St. James's to Mullingar, that there will be an adequate service for Mullingar Hospital. Dr. Ferguson, thank you for coming in, and I'll just leave it a time after the other speaker for anyone to come in with any questions. If you can stay with us for a few more moments. I just want to ask Eileen to join the call now. Eileen, can I call on you?
Yeah. Hi, can you hear me there?
Yeah. So if you want to introduce yourself and just talk a little bit around your experience, Eileen.
Yeah, first of all, sorry for delay. We had a bit of a technology blackout here, so I'm on the phone instead of the laptop, so apologies. Hi everyone, I'm Eileen. I'm from Longford, so my neurology base would be, well, preferably would be Mullingar, so I'll be talking from a Mullingar point of view. So I have, sorry, I had a thing kind of, so I'm going to be half reading a little bit from here, if that's okay. So I'll be looking at you on the phone there. But I appreciate your time for a few minutes. I wanted to speak a little bit as somebody with a few lived experiences. I have epilepsy and rare muscular dystrophy, but I'll focus on epilepsy, I suppose, today. But I also then would like to just question the cost, or not question, I would like to bring up a different swing on things, questioning the cost of having a neurologist versus actually the cost of not having a neurologist. So it's okay to speak about that today. So I'd appreciate a few minutes just to talk about that. My services are based in Mullingar and Dublin, but obviously because we don't have a neurology service as such, it is in Dublin. I was originally, I suppose I'm 15 years in the system. I was diagnosed at 26. So I'm about 15 years, I'm 40 now. I was about 15 years in the system. And I've spent a long time coming back from Dublin to Longford and giving out about how long you travel up and down and giving out about the services. And I am one of those people who'll sit in the pub on a Saturday night and give out about the services, give out about the politicians, you throw that in there and everything. And then you realise eventually actually there's nothing really to be gained from just coming home and giving out about them. And I've now come out the far side of being this long in it that I have found a voice to say it's about time to actually just join in with the likes of the NAI, join up with the politicians and start talking about it. So I have lived through the emergency, the inpatient, the outpatients, clinical care, all of that. So I'll just give a bit of a background on that. Before I give you the background, I do want to get straight to it. I think what is the point of us all being on this call today? What is the ask? And I think the reality is we're looking for a neurologist, or at least a neurologist that can link in. I am sorry I missed the start of Dr. Ferguson's call. Apologies on that. But that is, what we're here for today. So that's what we're looking for. In the regional, so I went to Mullingar originally with, after a few episodes, I went there with epilepsy, or turned out to be epilepsy, and I was diagnosed by a cardiologist. No fault of the man, a wonderful cardiologist, I was told after. But however, I was placed on an unsafe drug for my age, and I was put on a waiting list for 2 years for my neurological hospital in Dublin. And I was constantly being brought back to, or for the 2 years, I was being brought back to Mullingar for my annual checkups. Now, I suppose when you're out 26, 27, you're not kind of fully tuned in to what's, you're just not really fully tuned in to what's the right thing and the wrong thing. So I was going back to Mullingar and thinking that they were my neurological checkups. Really, I was just getting ECGs and saying, yeah, your med is working out and that's fine. But I didn't just really connect that it was a cardiologist I was seeing and not a neurologist until one day, excuse me, I didn't realise actually the kind of effect the med was having on me. And one of my family members kind of pulled me aside and said, "Are you okay?" Now, I was in no danger in the sense I was never going to do anything to myself, but they did recognize that mentally I was struggling. And we did realize that actually it was the med. There was nothing before that. And I realized that actually my mental health was taking a bit of a bashing. And I suppose if anyone is familiar with AEDs, your anti-epileptic drugs, I realized that the medication I was on was actually not being handled, I suppose, in the correct way, but just because I wasn't seeing a neurologist. So I'm not going to give any medical update on that. There is a doctor who knows what they're talking about here. But I eventually fought to make sure I was brought to Dublin to a neurological appointment, and I was, and my medications were changed from there. And after that, my life changed completely in the sense that all of a sudden epilepsy wasn't such a battle for me, because before that it totally changed my life when it didn't really need to. I was a very bubbly, very confident person, but you're on a medication that just changes things. So sorry, I'm just flicking through a few bits here. I was lucky that there was somebody in my family recognised that I was not on the right medication. And again, staff at Mullingar weren't to blame, but the lack of neurology certainly was. That was around 2013. And then I travelled ever since for my clinic appointments, so my outpatient appointments to Dublin. And I wasn't aware that this was unusual. I just presumed that epilepsy was too dangerous to treat in a regional hospital, because I suppose in Ireland, a regional hospital is always just seen as for your local, maybe, broken bones, things like that. And when you're not tuned in and you've never had anything more serious, that's just what a regional is to you. Yes, then when you look into the details, there are over 40,000, up on 45,000 people, I think, have epilepsy in Ireland. And then all of a sudden it kind of hits you. Well, why is that not available to us in our regional? Now, the more I have become into my advocacy role, you realise in 2026, I'm still travelling to Dublin for my outpatient appointments. But then I've come across something lately that I have to bear in mind. In 2018, Ireland actually ratified a United Nations Convention. Now, I'm not going to go down into a massive loophole on this, because maybe today is not the day. But there's a very important thing here, that in Article 23 of that, it states that those with disabilities and long-term chronic illnesses, we are actually meant to be getting equitable healthcare in our regional areas. Now, Ireland have a very proud, and I know, we give out about the HSE and all of that, we have a very proud background in how well we look after our own people. But actually, when you think about it, we are absolutely policy rich in this country, but we are implementation poor. We love putting pen to paper. We love putting pen to paper for everything and anything, but actually carrying it out we're not great at it. We just are not great at it. And we're very proud to be seen, and we're very proud to have all of our politicians and every area of the country out taking in this European presidency this summer. And we're delighted with that. But I would love that the people in this group, not all of us, we don't all have the power to do it. But when you look at it realistically, wouldn't it be amazing that some of us in this group today were responsible for saying, hold on a minute, we actually ratified an agreement that people with long-term chronic illnesses were actually told that in 2018 we're deserving, through a human rights act in 2018, we're actually signed in that we would have this power. Wouldn't it be lovely if somebody left this group today and actually went and said to somebody, well, in 2026, let's just shove this over a line a little bit and show Europe what we're capable of. We love to do what Europe are doing and all of that. So let's show what Ireland are capable of. So let's let somebody's name leave this group today, whoever it is, and say, actually, we were part of that. Whether you're a neurologist, part of NAI, whether you're a politician, whoever you are, let's get the movement on that, because we're a long time from 2018 and we're still not there yet. So just to move on a little bit in terms of emergency situations, where are we with emergency situations and neurology? Telemedicine is wonderful. When it comes to Mullingar, I've seen the use of telemedicine in several things, and it's obviously improving lots of situations. But time is life when it comes to quality and health, and every second and every minute is massively important, and every person is massively important, but sometimes it doesn't cut it when we're not afforded that, and we can only talk about neurology today. Unfortunately, 2 years ago, so just today, we're celebrating that we have one little girl. She's 4 just today, but before we had Tessa, we had several losses, and that's just the way of life. That's nothing to do with this talk today. But we had Tessa and it was great. However, it played havoc with my epilepsy. And afterwards, some of my medication was just not tapered. I won't say correctly. It was it was between myself and my Dublin hospital. However, when we became pregnant again, when Tessa was about 2, unfortunately for my health, not so much the health of my unborn child, that was also obviously a huge factor. And I really wanted to go ahead with the pregnancy. But unfortunately, my epilepsy was not, they didn't feel it was the right thing for me to go on with that. So we had to make one of our most difficult decisions in our lives. And we had to end that pregnancy. Now that was, we're not going to get into that detail and difficulty today with you, but it was a terrible thing to have to do. However, while that was meant to last about 2 weeks, it actually went on for 5 weeks, and that was due to a lack of neurology in Mullingar, because Mullingar were my regional hospital. And you might be wondering, where am I going with this story to you? And that is because I was not allowed to have a D&C, because they were afraid with my epilepsy that they didn't have a neurologist on site if they were to do a D&C. I continued to work. I'm a science teacher. I continued to work for 3 weeks, and I said, okay, this is going to end at some stage. But in the 4th week, we had to go to Mullingar and say, listen, we need a D&C. I got some more scans. And at one stage, the sonographer or radiographer, sorry, the correct terminology, escapes me at the moment, but they said, we think this woman needs a D&C. But the doctors were just not, they just felt, no, we don't think so. The neurologist is not here. And we were told the neurologist calls once every 3 weeks. And we couldn't really believe this. Now, my husband is well, he's well in charge of my epilepsy in terms of he knows when I'm starting to go into little seizures. And I sat in front of a doctor trying to kind of hold myself together, not necessarily emotionally. That's, another story for another day. But I knew I was starting to go into small seizures. And the doctor said, I think she's fine. We'll wait until the Friday. And that was of week 4. And my husband said she is starting to go into her smaller absent seizures. So they said, come back up next week. They gave me some medication, and they said, we don't want to do a D&C. And they contacted my Dublin hospital, and they as good as said, she's yours now. So the cohesion between the 2 hospitals, the lack of communication was just astounding. We couldn't believe that with everything else we were dealing with, but this was what was happening. Anyway, long story short, in that situation was, the following Wednesday we went in, and I knew I was starting my absent seizures. And the doctor said, we think you should go home, maybe come back Friday, and we'll do it then if we feel we need to. Our neurologist is probably due to us then. I went home that evening and I packed the hospital bag. That's not to sound dramatic, a nightie and a toothbrush. But I spent the evening with my daughter that evening, because I knew I was going to go into seizures. And I knew that if I did not know what was going to happen. And I went by ambulance that night to Mullingar with probably some of the worst seizures I'd had in my life. And there was a huge, big debacle the following day about what to do with me. And I had a D&C on the Friday. They had to wait 24 hours till after the seizures. And in the end, yes, I got an apology and all that. I didn't need an apology. They weren't neurologists. But do you see where I'm coming from in the point? And I'm not saying all this story to try and have a sob story. I'm saying that in that moment, the help wasn't there. The help was needed, but there was no neurology in sight. And we kept being told, he's coming, he's coming, he's coming. But I was living almost a week in small absent seizures. And then when I had the really bad ones, we were brought back. And it was just, I just felt like, this is 2024. Is this happening? Is this real? So, in that moment, who was I? I was somebody's wife. I was a daughter. I was a mother to a small child. I was a voter. I was a taxpayer. I was a constituent. The word doesn't really matter. I was a human who deserved to get what I was asking for. But because I lived beside a regional and not in a Dublin hospital, that's what went on for 5 weeks. So, that's a lived experience. And this is where I'd like to put in, before there is one more I'd like to give. But this is where my question would be, in that moment or in the few weeks after that, I decided when I came through that I would put my voice to getting neurology into Mullingar Hospital, because the cost roughly is about 250,000 to get a neurologist. Now, presumably there's several more thousand to go with that, have an adequate team and all that kind of thing. But what is the cost, maybe non-financially to have left me in potential seizures when I wouldn't be brought to Dublin? What was the cost of me potentially having a seizure that would have left me in such a bad way that my husband may have raised my daughter? Because it turned out when I went to the Beaumont monitoring unit afterwards, it turned out my epilepsy had changed from one side of my brain to the other. Yes, that's rare, but we didn't know that at the time. I could have had serious brain damage, but it's okay because I was just in a regional, 250,000 is nothing to a government. I don't know the government accounts, but people hear online, some people do. I hope that point is coming across. You lose somebody very quickly by not putting in place a management scenario, and that's where that money is needed. It's not always just the neurologist. That money needs to go into a management scenario and where the money goes. So I'll move on from that just quickly. I'll just, some of that can go on to that. I just want to move on to, I did speak to a doctor before I came on this meeting today. I was trying to do some research, but obviously there is a doctor here, so I won't bring any major medical points into that. But I spoke to her and I put the question to her, what is the cost of not having a neurologist, or anyone at the time? But in this case, we're talking about neurology. What is the cost of not having neurology on the floor or clinically? What is that cost? And that was my question. And they actually said, well, what is the cost of not having it? So I'm going to reframe my last final lived experience in this for you, if you can bear with me just for a couple of minutes. And this one is really, really important because this is where it opens up the floor to young, to old people. So I'll reframe that question that I will ask you, that I'll be saying to you at the very end of my time. What is the cost of having a neurologist versus not having a neurologist in a regional hospital? With a final lived experience, I'll put you one of a person who can't speak for himself today. At 75, my father had a stroke. He did pass away 2 years ago at 73. Now, his care was mostly in Dublin, bearing in mind we're from Longford. His care was in Dublin because that was where he had the best chance. He had his surgery in Beaumont, and then he was moved to St. James's. He had an incident where he had to go to Mullingar at 73. He had a great, what we call his bonus years, and they were fantastic up until his last year. And I am going to read this because this is important. In an event when he ended up in Mullingar, over 3 or 4 days, he went into status epilepticus. Dr. Ferguson would give a better explanation of that, but it means that after about 5 minutes, you are in an emergency situation and you should be somewhere safe with a doctor, or you haven't taken your emergency meds. When you are brought to a hospital in a situation like that, you're in a safe place. Daddy was brought to Mullingar Hospital, and the doctors and nurses did not know what to do. Now, he went into status epilepticus in Mullingar Hospital. He only went in with a seizure, and they were not epilepsy seizures. They were post-stroke seizures. But he went to a hospital to be minded and to take care of him. He was minded very well by the staff. I want to be very clear on that. I'm not bashing any hospital staff, but there was no neurologist on site. So what I would say is, as a family of 7 and with my mum, who's in good health, we minded him over those weeks because Dad had aphasia, so his speech was not very clear. So we were there to make sure he was understood. Eventually, on the 4th day, his seizures had went to a stage where he was actually having a seizure every 1.5 minutes, and they were lasting for 1.5 minutes. A carer was specifically put by his bed to time them. And when his consultant came back on the Monday, I happened to be the sibling that was back kind of by his bedside. I was off that day and I was there. And at that stage, the consultant said, it's okay, our neurologist is due in midweek or towards the end of the week. And I said, this is not okay. I said, he's absolutely in status. The man needs to see ICU. Can we move him to James's? But he could not be moved to James's because he was not in ICU in Mullingar. And he said, the consultant said, it's okay, we will have our neurologist in to see him. And I said, at this rate, we are looking for either an undertaker or the guards. That sounds harsh. And strangely, when I'm very emotional in that case, I actually become very calm. And myself and the consultant had a very calm conversation. And he understood that the man needed to go to ICU. But it took somebody who was very experienced in epilepsy having a conversation with a consultant who I do not dare take down from his position, we then decided to talk to ICU. Dad was brought to ICU, and from there he was allowed to be transferred to James's. I don't know about the rest of you, but I come from a farming background, and if somebody was left lying an animal for 4 days in seizures, that is enough to say. But as human rights go, that is absolutely not okay. And we had to do our best to protect my father in that way. And it all went very calmly and smoothly. but again, that was by region. It's back to your postcode lottery or whatever the terminology is for it. So my last part, I'm going to say to you, I've taken up enough of your time, but this is what I'll say to you, if that's okay. So to finish, I will put to the floor or to the online forum, what is the cost of a neurology team in Mullingar Hospital? Financially, to the government, it is €250,000. However, not putting it in means, in this case, say a man putting into a bed, suffering without the correct treatment, and then eventually brought to Dublin, where he ended up taking 3 weeks in a bed. Now, from there, I'll move from my father to everybody's somebody. 3 weeks in a bed could have been given to somebody else had the regional had neurology and been able to keep my father or anybody's somebody there. For all neurology communities, for any family, emotional distress, waiting for diagnosis. And this, I think, is a really, really important point. A non-expert doctor will always call for several unnecessary tests. And I've had that with a rare muscular dystrophy. I've had several unnecessary tests costing money to the government, whereas a neurologist on the floor or in clinic will be able to say, let's pin this down to maybe 2 or 3 things and send for less costly, more effective tests. There's times when early intervention is key. We have seen that across all health floors. Reduce disability services because the time is not wasted waiting for these tests. Less time in A&E and more needed beds, lost income to almost everyone involved. The list is endless. I could talk all day about it, but the cost of not doing this is priceless. It is not the few $100,000 to the government in one small regional area. We just simply need neurology in the area. It's not a want. It is not a luxury. It's a need. That is all I have to say from my part today. I hope I have not wasted your time, but it is something I am hugely passionate. We need neurology in Mullingar, and if that means sharing with Tullamore, it means that people are healthier, safer, and better off in Ireland, and we deserve it. That's me done for today, and I'm open to any correction on anything I've said. And thank you for your time.
Thank you so much, Eileen, for sharing such deeply personal experiences on the call today. We really appreciate it. And I suppose just to, as you've acknowledged, every effort is made by the local hospitals to provide the best care that they can. And I know that there is in place as Dr. Ferguson has outlined, that there is in place a phone service if regional hospitals do have concerns around management of specific patients, and they have access to that expertise in Dublin hospitals. But I suppose what we're highlighting on the call this afternoon is that trudge, that at least a couple of times a year of people making that journey to Dublin hospitals, having to make that journey, having to take days off work, having maybe a family member to take days off work for a service that should be available in their local hospital. And Eileen, you referred to reports. I'll throw another one at you, which is the National Model of Care for Neurology. The landmark policy document's over a decade old this year, and that stipulates that every Model 3 hospital throughout the country should have a dedicated neurology service. And what we are seeing, as you say, is that postcode lottery for some hospitals, like down the road in Portlaoise, and there's a much better resourced neurology service than there is for Tullamore and Mullingar hospitals. So I'm going to open up the meeting to, I know we have a number of patient organisations represented on the call today. I'm just going to open up the meeting for any of them who want to speak about the local needs in the area and the experiences of local people living with neurological conditions. Eamon, you want to come in there?
Thanks, Max. And thanks, Dr. Ferguson, and thanks, Eileen, for sharing her powerful story. For those that don't know me, I'm the founder of F&D Ireland, a new charity that supports those living with functional neurological disorder. I live with the condition myself and also dystonia. I'm also the lived experience board member at the Neurological Alliance of Ireland. So I suppose I have 2 parts of what I'm just going to briefly share. Firstly, just to echo the challenges that Eileen has faced, which so many people that would attend our peer support meeting from Longford and Westmeath in relation to Mullingar Hospital. I know even the waiting list to see a neurologist before the current issue of the change from the Mater to St. James's was extremely long. And obviously, just to re-echo as Eileen has said and Dr. Ferguson has said, the need to get that neurology post in place. But as important is the multidisciplinary team around the neurologist, because a lot of people find it very difficult in primary care settings to access that team. Now, I suppose one bit of fortunate news is that with St. James's linking in to Mullingar is that there is a pathway for some of those with F&D to the small multidisciplinary clinic in St. James's, which is very helpful. And the other thing I just want to echo is, again, Eileen had mentioned there, the inequity of access to neurological services regionally. And I know people on the call that know me probably are fed up of me repeating the same message, coming from a region that has very limited neurological services access. I myself travel to Dublin as well, a 6-hour round trip for my neurology team. And I think the quality of life impact that has, where people have to make them long trips, is very challenging, especially those with complex neurological conditions. And unfortunately, we didn't have a local lived experience representative with F&D to come on today because just unfortunately, they weren't able to, is what they said to me. So it's great actually to see some familiar politicians here. And I see Michal there, or his office is going to come in, who would have good understanding of F&D and the challenges faced by those locally in Longford in particular. So I just want to support Eileen and everyone else that has lived experience of a neurological condition, how important it is to have that regional access to not just neurology services, but to the multidisciplinary team to support that. And just one question, if it's okay to ask Dr. Ferguson, you mentioned there figures in relation to seizures. I was wondering, was that just epileptic seizures, or did that include functional seizures? So thanks.
So the audit that we carried out included epileptic and non-epileptic seizures, but the difficulty being that we're auditing what other doctors' diagnoses have been and not a neurologist's diagnosis. So it was just often coded as seizure, and then we would check the St. James's record to see if they've ever been to see us. But as you saw from the data, only 29% made it to St. James's. So actually there might be people out there who think they've a functional seizure, but they've an epileptic seizure, and there might be people who vice versa. So it's a challenge.
I want to just let, I know there's Michal Carraghy's office want to join in there. Can you hear us okay? Yeah.
Yeah, apologies now off the screen. So I just wanted again, because I just have to go to something at 10 to 2. So my apologies for jumping in ahead of somebody else if need be. Look, I'll say I know Eamon quite well. I would have chatted to numerous times over the years. Look, at my job, my role as a public rep in Longford Westmeath is to make sure we have the best services we can have in Longford Westmeath. I only had a meeting only a number of weeks ago with Cara Broadbank, who's the CEO of the RHO area, and that's something I will take to her again and look for an updated meeting to push through that avenue with regard to services in Mullingar, which serves the people of Longford as well. So look, that's a commitment. I might ask Damien if you could send me on just your presentation and figures that you gave earlier, if I could have them in hard format if possible. And look, as I say, I'll continue to link in with yourselves and advocate and push for services in Mullingar to make sure, and we're entitled to have the same services that you have in your major urban settings. So thanks very much for the presentation, and thanks to Eileen for giving your experience. And what we have to do is work collectively to make sure anybody else has a different experience, and that we're able to, as I say, get referred locally and not have to, as Emma said, be travelling up and down to Dublin and not being able to get quicker support.
Thank you.
So I give that commitment here that I'll work with yourself there, Madeline, with the NAI, in advocating. I have already sent in a request for an updated meeting with the CEO of the RHO area that covers this region. And as I say, we'll forward all the correspondence into the Minister of Health and the HSE as well. So thank you.
Thank you. Thank you very much. And we appreciate your support. And we hope to see you on the 24th of June in Buzzwells for our pre-budget launch. And we'll be issuing a regional press release from that meeting as well. We'll definitely stay in touch. Thank you so much for your support.
All right, thank you.
Anyone else wants to come in on the call? Okay. I think I might be able to give people a little bit of their lunchtime back. Oh, Eileen, you wanted to come again there just for some final words.
Sorry, just everyone was about to go. Sorry, I know. I know you had said there about the when I had finished. I know it sounded like I was saying just about all being in Mullingar. I suppose what I hadn't added was, yeah, all of our care was up in Dublin all of the time. So in case it sounded like it was all just saying about Mullingar, as you had said, yeah, we had said Mullingar were excellent for everything else. But I suppose, as you had said, the call is as well to make sure we have our regional outpatients care as well, like Eamon had said. I think it's that kind of kick in the teeth that it was always kind of 8 years up and down to Dublin, or for myself, for epilepsy, it's since 2013 up and down to Dublin. So yes, so I had meant to mention that as well. It's that everything seems to be in Dublin and you end up in Mullingar when you just have to. And it would be terrible for us to feel like Mullingar is just a last stop, that is somewhere we just have to be because we have to be. It would be lovely to be proud to say, you know, no, we'll go to Mullingar, and not just because the child got sent from MyDoc or something like that, you know. And exactly as Michal said there, we do deserve to have it. But yeah, that's what I meant to say as well. Everything was up and down to Dublin, but it would be lovely to be able to say, no, we've no problem going to Mullingar, because the staff are actually wonderful up there. Like, to be honest, at stages we got to know some of them by name, and that is, we're entitled to it, but they are great up there. It's just we don't want to be bypassing it all the time. It's a waste of a resource if we're not investing in it, you know.
I say we're not asking for something that isn't government policy. I say that the model of care for neurology does stipulate that all Model 3 hospitals should have a dedicated neurology service. And what we're seeing at the moment is that some regional hospitals have a better neurology service than others. And that is, as Eamon and yourself have pointed out, Eileen, that is an inequitable situation. Dr. Ferguson, did you want to come in there just with another comment?
I really just wanted to echo Eamon and Eileen's points. A couple of them. So I'm originally from the very bottom of Wexford, a small village, and my own father has to travel to St. Vincent's for his neurological care every 3 months. So I really believe in a proper all level 3 hospitals with all of the specialties, equitable care across the country. And then the other thing was just to echo that the staff in Tullamore Hospital are absolutely phenomenal. They do their best all the time, but they're not neurologists. They do not know the subtleties of a neurological examination. And it's okay doing virtual neurology when a patient already has their diagnosis. But if a patient does not have a diagnosis already, I cannot make head nor tail of what I'm being told over the phone from Tullamore, because they're not neurologists. They don't know the ins and outs of it. And what Eileen said as well, there's over investigation, you know, scanning the wrong part of the body. So, you know, there's a whole education piece that I've been working on in Tullamore for 2 years, and we're making gains. But again, on point 2 of a contract, I cannot provide as much education as I would like to provide down there. So I really would love the support of the local government representatives to help bring equitable care to the Midlands.
Thank you. I think that's a really important point, that there is room for both. There is the need sometimes for people to travel for specialist care, but it should also be available near to where they live, in line with Sláinte care. And we've heard that very strongly this afternoon. As I say, we will be launching our pre-budget submission on the 24th of June in Buzzwells Hotel. We will be following up with all of the elected representatives locally, as well as all of our elected representatives across the country, to come along to that pre-budget launch. And we will be issuing a national and local press releases following on from that event. But in the meantime, I'd like to thank you all so much for your support this afternoon, for sharing such personal experiences, and Dr. President for your professional expertise, Eileen and Eamon for speaking at the meeting this afternoon, and to all of the TDs and elected representatives who's joined us or been represented this afternoon. Thank you so much for your support.